Going overseas for major dental work is a bad idea. Let's talk about why. First of all, let's talk about some of the key places that people want to go for major dental work overseas. Some of those top four are going to be Mexico, Turkey, Costa Rica, and Thailand. Some of those things that you want to consider when going overseas to get this dental work done is cost.
So why do people go there? Okay, so the reason they go is because they want to save money on the dental expenses of why they go to have this dental treatment done. But you have to also consider the risks and the benefits of going overseas to have this dental work done in the first place.
Yes. So when you're thinking about traveling, we all know that there are some places that like to make it look like it's a vacation. At the same time, they're like, oh, we're going to a resort. It's all inclusive. You get to stay in this nice hotel and have all this great food, which of course always looks good. But there's a lot more that goes in depth with that and how far they are away from you because you have to think about those complications. So let's talk about what some of those complications can be, Dr. K.
Sure. So you have to realize that, having major dental work done, and in this video, we're talking more about dental implants, whether it's a single implant to a full mouth of implants for a person, for example, losing all their teeth or they've already lost their teeth and have been in dentures for, 6 months or a year or more. You have to realize that this is a very invasive procedure and there are a lot of things that goes into, this type of surgery. And it's not just about, having an implant placed into the bone. The health factors for the patient is a big risk that, sometimes patients may not be healthy. Does your doctor overseas check your, blood work before you go in? Have you had a pre-op with your primary care physician, for example, or, if you're on blood thinners? There's so many variety of things that has to be considered before you even decide you want to have this procedure done.
The one major thing about this is that there is a healing time, okay? There's a time where once the implant is placed, whether you're doing a single implant or maybe even a full mouth all on four procedure, there is a time called osteointegration, which is where your implant has to become one and solid with the bone. You can't put a lot of pressure on them. You can't just be chewing and eating whatever you'd like because there's a chance that they may not integrate and they could fail. Now, if you get the procedure done, you have your little vacation, everything went great, and then you fly home, and then sure enough, here we are maybe 3 weeks post procedure or a month later, we start noticing that you're having pain, there could be bleeding, your prosthetic, which if you're in a temporary, may break. There's just so many things that could happen. And are you going to be able to financially turn around and fly back over there to get that taken care of? It's definitely there's gonna be a lot more costs that go into that.
So another thing that you have to consider is going overseas is that every country has their own regulations and standards of care of having, their doctors trained, and the experience level of the doctors there as well. In America, the doctors that are usually doing this procedure have to go through a rigorous training to make sure that they're even qualified to do this procedure. When you go overseas to have this procedure done, you have to make sure that the doctor, one, is very trained and knowledgeable about this procedure that you're getting done. But also knowing that, what are the standards of care, in that country or that state that you're going to. And as far as, what are the sterilization techniques that they're going through with their instruments? What are the quality of the implants? There's so many different implants. Is it a knockoff implant? Is it, a mom and pop, place where they got the implants from? Or is it like a major brand that's international? It is a medical grade, dental grade implant that's being placed. So you have to also consider all these factors, and sometimes as the, saying says, is that, you get what you pay for. Definitely this is the reason why we recommend you get your dental procedures done in a place where you live and you can travel to that doctor in a period of time where, like, if you have an issue with it or a complication, you can just call your doctor and just get seen right away.
Okay. So with America, like Dr. K said, we hold higher standards in care. Our doctors here in America have to go through rigorous continuing education. They have to stay abreast with all the current technologies and upgrades to all the guidelines, the state board procedures for their state that they work in, and there's just so much more that goes into it. We have to follow things the way they are because we have to make sure that the patient themselves is going to get the best standard of care possible.
Correct. So we always will put the patient first, making sure the patient is healthy and they get the outcome that they're paying for. So we want their quality of life to be great. We want them to enjoy this procedure, whether it's a single tooth or a full mouth of implants, because we want them to have a healthy and correct smile after the procedure. And it just sometimes when you get something done overseas, especially dental work, you just don't know what you're getting. And there's also one other major factor is the ongoing maintenance involved with dental implants.
You're gonna wanna make sure that when you go to these consults, your most of the time, these doctors should be getting medical clearances with your PCP. They should be checking your blood work. If you're diabetic, we need to make sure that the A1C is controlled. If you're diabetic and you're not taking care of yourself and your numbers are super high, the chances of those implants integrating is very, very slim. You're more than likely gonna have complications, and you're gonna have a lot more slower healing time, meaning by the time you even get into your finals, it's just gonna be an ongoing process. You're not gonna be able to get into it as routinely as somebody who was taking care of themselves and has a lower, A1C. Also, you have to think about if you're a smoker. If you've been a smoker for years, a lot of times there's no, bleeding, that happens when we place the implants. Tell me a little bit more about that, please.
So, with heavy smokers, especially, we have a lot of patients. We have had great success that do smoke and they have dental implants and they do just fine. But especially with chronic heavy smokers that smoke a pack or more a day, for people who smoke a pack a day or more, nicotine causes vasoconstriction of the blood vessels. So, when we during these surgeries, we actually want to see bleeding in the sockets, and that allows the bone to heal. It gives all the nutrients and all the growth factors that's needed to build new bone. And sometimes when we do the surgeries on those type of patients, we get very little, if no bone, we get very little or no bleeding, and that basically says that they're not going to heal very well.
If you're finding everything that we're saying very interesting and you're interested in coming to see us at the office, please either click on the link below or you can call us at 469-625-0005 to schedule an appointment. The consultations are free.
Thank you.